Health information technology and the dehumanization of healthcare. Health information technology. What is health information technology? It involves the processing, storage, and exchange of health information in an electronic environment. There are positive effects of health IT on healthcare. Widespread use of health IT within the healthcare industry will improve the quality of healthcare, prevent medical errors, reduce healthcare costs, increase administrative efficiencies, decrease paperwork, and expand access to affordable healthcare. Doctors, technicians, and nurses can upload the data to digital form, allowing for quick and easy access. Electronic health records provide quick access to comprehensive medical history. With this information at their fingertips, diagnosis and treatment has never been easier. Please take your time and take a look at more positive effects of health IT on healthcare. What are the negative effects of health IT on healthcare? They consist of increased costs, impersonal healthcare, centralized data storage, and hacking of medical records. What is the HITECH Act? This act, also known as the Health Information Technology for Economic and Clinical Health Act, was signed into law in 2009. It was part of the economic stimulus bill, the American Reinvestment and Recovery Act, and was designed to promote and incentivize the adoption and use of electronic health records across healthcare settings in the United States, and the program has been very successful. The number of office-based physicians using certified EHRs reached about 83% in 2014, and hospital use is up to about 93%. The primary goal of the HITECH Act in promoting the use of EHRs was to improve the quality, safety, and efficiency of healthcare, preventing medical errors, reducing redundancy, coordinating care, facilitating communication, and lowering costs was also the aim. Has there been a dehumanization of patient treatment? After the introduction of health IT, many times during the doctor and patient conversation, very little of the patient's experiences are acknowledged. The doctors are normally disengaged from the patient after several months of working with EHRs. Also, very little of what the patient is trying to communicate is captured in the EHRs. The input of the data into the EHRs does not represent many of the serious concerns that patients are attempting to tell the physicians. Instead, the physicians have gotten used to compiling and dutifully translating the patients into a series of structured data points required by the EHRs. There is a very important question that we must ask. Whether a clinic's use of health IT is improving the patient's care, or is it functioning primarily as a tool for billing and profit generation, defensive medicine, and malpractice avoidance? Let's take a look at the loss of privacy regarding dehumanization of patient treatment. In addition to fears about quality of care and the patient-doctor relationship, some worry that EHRs may lead to loss of privacy or the misuse of personal information. All technologies need safeguards, regulations, or guidelines on proper use to protect us from abuses of the new powers these technologies give us. The Health Information Portability and Accountability Act, also known as HIPAA, has laid out stringent privacy rules for electronic health information, but it is up to professional associations and trade organizations and the government to ensure that effective rules are designed and established to protect a patient's privacy. A patient's desire for emotional connection, reassurance, and a healing touch from their caregivers is well documented and long-standing. Studies also demonstrate the effectiveness of the therapeutic touch of physicians who care and connect emotionally with their patients. We are human. Humans require human touch and human interaction that is necessary for our mental health. We have to keep that into consideration when we provide health care. It is understandable that there are costs associated with health care, but technology should not be used to only increase the profits. Providing great health care and incorporating advanced technologies should always be balanced, remembering that technology should never outweigh our basic human needs and never depending solely on technology when caring for patients is a great way to maintain that balance.